Our final presentation today will feature a partnership to expand mental health services in Michigan schools. Blue Cross Blue Shield of Michigan Foundation is committed to improving the health of all Michigan residents, and they have been a leader in supporting innovative solutions to improve teen mental health. By partnering with the TRAILS program, they have worked to improve youth access to evidence-based mental health services by training school mental health professionals in effective practices such as cognitive behavioral therapy and mindfulness. We'll hear first from Audrey Harvey at Blue Cross Blue Shield of Michigan Foundation. Audrey joined Blue Cross of Michigan in 1991 and has served in a variety of roles before becoming the foundation's executive director and CEO. In her current role, she oversees the foundation's portfolio of grants to Michigan-based researchers and nonprofit organizations, and she's very passionate about improving the lives of Michigan residents, and we'll hear more about that shortly. We will also hear from Elizabeth Koschmann, who is a faculty member at the University of Michigan Department of Psychiatry and the director of the TRAILS program. In addition to spearheading the original TRAILS pilot project, Dr. Koschmann has worked extensively as a trainer and consultant for a variety of academic and community-based audiences. We're pleased to have both of them here with us today. I'm going to turn it over to them. Audrey?
Good afternoon, and thank you for including the Foundation and the TRAILS program in this wonderful webinar today. As you said, I'm Audrey Harvey, the Executive Director and CEO of the Foundation, and I am pleased to say, as you reiterated, we're a foundation that's completely endowed, and having never received funds from Blue Cross, maintain an endowment of about $60 million, which means we give grants every year for about $2 to $3 million with a focus on the entire state of Michigan in all 83 counties. We do split up our work between those research projects that are often conducted by universities and professors, hospitals, and then those that are conducted by the community that tend to be innovative solutions to the problems that they're seeing where they are located. On slide 3, you'll see that we've done a great deal just in the past 2 years of working on issues that impact the health of teens and their families, and I'm very pleased to say that, as John indicated, the work that you'll see here has focused on 3 of the areas that he pointed out. You'll see that there are projects that would support and nurture families, those that would promote positive pathways to educational life and success, and then those that create community environments that promote mental health and physical health. And we've worked to partner with others to increase the funding for this prevention. I would say if there's anyone that has interest in any of those projects, my information will be included, to please send us a note. We are very happy to share those projects as well as those project directors. But the one that we want to focus on today is the one with University of Michigan and the TRAILS project. The TRAILS project is a very powerful collaborative that is a public-private collaborative that was really put together by Andrea Cole, the executive director of the Ethel and James Flynn Foundation. She pulled together several foundations, both the Blue Cross Foundation, the Michigan Health Endowment, Metro Health Foundation, the Children's Foundation, the Jewish Fund, DMC Foundation, and the Community Foundation for Southeast Michigan, and more importantly, much to what Alex talked about just recently, also the project receives funding from the Centers for Medicaid and Medicare Services, as well as support from the Michigan Health and Human Services Department. So this is one of the 3 collaboratives that are public-private partnerships that the Foundation is involved with, and is very powerful, because what this program will do is bring resources to each of the city, the Detroit Public School Community District schools, 110 of them, and will reach about 50,000 students. But what I'd like to do at this point is simply turn it over to allow you to get to the meat and potatoes of our presentation and turn it to Dr. Elizabeth Koschmann.
Hi, thank you so much for having me here and to hear those comments, Audrey, about our partnership with you. We're very grateful for your support. and I'm really honored to be a part of this panel today. So I'd like to just speak very briefly about the TRAILS program. We are, as Audrey mentioned, a pretty unique university-community collaboration. And our goal at TRAILS is to improve youth access to multi-tiered evidence-based mental health support services. And I feel that the prior panelists today, especially Dr. Ethier and Ms. Mays, really set a perfect platform for me to talk very briefly about the TRAILS model. Right now, we're active in approximately 350 schools across the majority of Michigan's 83 counties. And certainly what I would say is that, I'm having a hard time with my slides, there we go. What I would say is that the comments that you've heard already today about the critical role of cross-sector partnerships and engaging local communities in our work is absolutely true. And I usually have a slide up to acknowledge all of the support we get, mostly to express our gratitude. But in this context, I also want to highlight the diversity of partnerships that we have here, and to comment that the role of all of these local foundations and supporters is certainly not just to offer that financial support that, of course, is so critical, but also to help build our community connections. And that is going to be extremely apparent as I go on to talk about our work in Detroit and Detroit Public Schools Community District in particular. Just waiting for that slide. So I don't have to spend a lot of time, I think, setting up the problem that TRAILS is really focused on responding to. The prior presentations this morning really highlighted this tripartite problem, that we have high rates of mental illness in school-aged youth, difficulties with treatment access due to, of course, a multitude of barriers. And the result is that we have a situation in which our public schools are housing those students and providing the vast majority of mental health services that those students receive. And I was really interested to hear Alex speaking about the role of those school-employed partners, those school social workers, counselors, psychologists, and how many of them really are providing that mental health service. And yet we know that staff and faculty in those positions often really struggle to access ongoing professional development, resources, or the supports that they need to adopt or sustain evidence-based practice delivery with good fidelity. And so at TRAILS, we have tried to use the best evidence from the literature to inform our model for resolving this gap between a school that's perfectly positioned to reach many students and certainly is providing a vast majority of that mental health support to their student population, but often lacks access to the training, resources, and supports that they need to deliver that care effectively. So as you heard in many of those other presentations today, there's a lot of lessons that have been learned in terms of what makes solutions to that research to practice gap viable. And I want to just pause and highlight a few of those that have really informed development of the TRAILS model. In particular, I want to highlight one of those on the screen is this idea that when we're pushing a model to improve the quality of mental health care service delivery in schools, we really wanted to focus on streamlined interventions and generalizable interventions so that those school social workers and counselors that are serving students are able to utilize skills that we push out to their communities with a wide audience of students. We also have learned from other partnerships and research in the field of implementation science the critical role of engaging those multiple stakeholders across sectors, and particularly in including school leadership. So you're going to hear in my next few slides and comments how we really worked in the Detroit community to build a strong coalition, not only with our community partners, bridging community mental health and local providers, but also starting at the outset with a partnership with the leadership at Detroit Public Schools Community District. And then the last point that I want to highlight here is that we really wanted to build a model that would be appropriate for replication, that we wanted to design a model that could be sustained long-term by existing and established funding sources. And so as you're going to hear my comments, you're going to be able to note ways in which we were trying to stay clear of the risk of building a program that had to rely on grant funding that could be only delivered in 1-year or 2-year increments, but really we wanted to build a model that could take advantage of that ESSA program, of Medicaid, CHIP, public and block grants, title funds, and certainly here in Michigan, we're very interested in the fairly new model of allowing schools to use that Medicaid funding to bill for some of the services that we're supporting schools to deliver. So I'm going to go ahead and introduce the program now. TRAILS is an acronym that stands for Transforming Research into Action to Improve the Lives of Students. And the program really is built on 3 pillars. We provide didactic instruction for those school staff that are providing the majority of that mental health support in the building. We also have an extensive library of online clinical resources that support treatment and care delivery in the school setting. But what makes TRAILS especially unique is that we don't just stop with providing professional development and online resources, but we actually provide extensive post-training implementation support, and that's the coaching that you see up on the screen. And we found that without offering that follow-up coaching support, it's really difficult for schools to sustain their work long-term with students. You've already seen several models earlier in other comments today showcasing this 3-tiered approach, and we also felt it was really critical to align with these established models. And what I'm going to do in my next few comments is I'm going to highlight just one example of a program that TRAILS supports schools to deliver at each of those 3 tiers. So this slide looks like it's not showing perfectly up on the screen today. What I did want to just pause on for a moment was the idea that in order to engage with our school partners and our community supporters, we found it was really critical to have a logic model. So if the graphics were a little bit more seamless today, you would be able to see our logic model. But one thing I can just highlight here is that on the left, what you would see would be those inputs and early activities were really focused on building the support and also collecting data to identify what was critical at the community level so that we could ensure that any outcomes that we were working towards were aligned with district priorities and goals. So now I'm going to go on and just talk briefly about our work in Detroit in particular as a spotlight of one of our many projects. As I said, TRAILS is engaged already with the majority of counties in Michigan, but as Detroit Public Schools Community District is the largest district in the state with over 100 schools and 50,000 students, we consider this one of our largest and most critical initiatives currently. In terms of that broad stakeholder support, you can see up on the screen, there are many sectors that are involved in our work. Certainly here at the University of Michigan, our medical school, Department of Psychiatry, and Comprehensive Depression Center. We also partner closely with the School of Public Policy, who supports a lot of our evaluation work and data collection. Of course, the district itself, as well as you heard Audrey mention in her opening slide that there is a strong consortium of Michigan funders that have played a critical role, as well as state departments. And in Wayne County, very importantly, we partner with Detroit-Wayne Integrated Health Network, which contracts with a large number of the mental health agencies in Wayne County that provide community-based mental health care. Here's just a quick timeline of some of our primary goals in our work with Detroit Public Schools Community District. And as you can see, it begins with the really critical phase of a needs assessment, that we really wanted to take the time up front to collect information from the district about what they hope to accomplish through the partnership In year 2, where we are currently, we wanted to pilot some of the programs that came as recommendations from that needs assessment work. And then in years 3 and 4, we wanted to more fully implement programming district-wide and analyze the data that we collect to inform our understanding of program success. So it's beyond the scope of my comments today to talk in depth about the surveys that were administered across the district in Detroit and the findings that came out of that surveys. But I will just highlight, because this phase was so essential, we were able to collect almost 20,000 unique surveys from the district, spanning populations of students, staff, and families, as well as local community mental health providers and agencies, foundations, and even reaching into the security and police officers and other professional groups that are affiliated with the school district. And we're really looking to this data to inform not only the work that we do, but also to provide a clear baseline to help us evaluate that long-term impact. So returning now to that 3-tiered model, I'm going to just provide one example at each of these tiers of the kinds of supports that TRAILS helps schools to implement. So at Tier 1, TRAILS has recently developed a social-emotional learning curriculum for the classroom, and that is strongly aligned with the CASEL recommended 5 competency areas for social-emotional learning. Our curriculum is also very strongly grounded in the evidence-based theoretical framework of cognitive behavioral therapy. And as we built the model, we were really focused on ensuring that the model would be, for teachers who would be delivering our curriculum, low cost, low time in terms of time out from academic instruction, and low burden. So this curriculum will be piloted this fall across Detroit Public Schools and will be implemented district-wide in the coming couple of years. At Tier 2, we wanted to align a program with that social-emotional learning curriculum, but step up that level of care for kids with a higher level of need. And this is where I want to return for a moment to those 3 pillars that I mentioned at the outset: training, resources, and coaching as an implementation support. The way the TRAILS model works is that we provide professional development training for school mental health professionals in core elements of CBT. We also provide, as I mentioned, that library of free resources at our website, trails2wellness.org, which I'll share at the end of my comments. And those resources support all of the clinical skills and work that those school partners want to offer with their students. But what makes TRAILS unique is this coaching component. Coaching is provided directly at the school in person, and what we do is we establish TRAILS coaches who actually come out to the school and sit shoulder to shoulder with those school professionals, and they co-deliver student skills groups to real students who are impacted by symptoms of depression, anxiety, or post-traumatic stress, among other mental health concerns. By delivering coaching in person, we're able to help those school professionals really practice the skills that we teach, and they also receive feedback and support and help with planning for upcoming work that they might have with students. Now, in order to scale statewide, we had to develop a really robust coach network. And what you can see in the map on the left is that we currently have more than 100 coaches spread across the state of Michigan. And those coaches are primarily sourced from community mental health. We engage with community mental health agencies, and then their providers receive clinical training from us, as well as training in how to serve in their local communities as coaches. They also receive specific coaching resources and consultation from a supervisor here at TRAILS. One thing I want to mention was, in terms of developing this coach network to be able to scale our program and to partner with so many communities across Michigan, it was not a primary goal at TRAILS to improve the quality of mental health care provided in the CMH offices, but of course we were collecting data from those agencies as we were bringing coaches on to serve in their local communities. And what that data was showcasing for us was that, in fact, along the path to developing a coach network, we also were improving the quality of care that was offered at community mental health offices, in that the providers who participated to become coaches ultimately reported higher frequency use of evidence-based practices, particularly CBT, use of more widespread components of CBT, so using those higher level or more complex treatment skills, generalization of those treatment skills to the majority of their to their caseload cases. And when we looked at data from those cases that our Trails coaches were treating in their own clinical settings, we saw significant improvements in symptoms of depression and anxiety, and increased use among those clients of adaptive and effective coping skills. So moving back to our pyramid here, I'm just going to touch on one more program at Tier 3, and that is thinking about how to support schools to help their students at high risk of suicide. We know this is an area that schools are increasingly asking for support with, and there are many ways in which we could partner with schools. Certainly gatekeeper training is one of the most highly requested ways to partner. But in particular, I just want to highlight a tool that we developed locally in Washtenaw County that is now expanding to Detroit and Wayne County. And this is a tool to help improve care coordination across multiple settings. We had a lot of schools tell us that they were concerned about students at risk of suicide, and they would refer those students to a higher level of care, and then they wouldn't be able to know what happened to those students after those referrals were made. So what you see on the left side of the screen is a cover sheet of a packet that includes a standardized suicide risk screener, as well as scoring guidelines and triage recommendations. But on the right side of the screen, what you see is our Psychiatric Emergency Services Referral and Communication tool. And this tool has the top half, which is information that the schools provide when the referral is made from the school to an external higher level of care. The bottom half of the screen is recommendations and summaries that come from that external care provider. Usually this is the emergency department or a crisis team at the county level, and that information comes back to the school. And what we have found in our work so far locally is that not only has this tool improved care coordination, but it's also really increased the level of appropriateness of students who are appearing at the emergency department for a psychiatric evaluation. So those kids are more likely to be admitted through the ED rather than to be sent home without a follow-up admission. Lots of ways in which we are evaluating our work, certainly across the district, students, and families. And as we collect increasing data documenting the benefit of the Trails program, we have decided to move towards a model of readiness assessment so that as requests to bring the Trails program broadly across Michigan and more recently nationally, we are able to assist schools with evaluating their readiness to bring a program like Trails along. So I have a slide here for questions, but I think we're going to turn it back to the larger group to field those questions for all of the panelists today. Thank you.